to you about the link between depression and what you eat this morning. And depression is a problem for a lot of people. And depression, like bipolar depression, is affects about 1 in 100. About 1% of the population suffers with bipolar depression, and it is a real obstacle to life. I was just reading some statistics on people who, regarding bipolar depression. It's pretty shocking. Let me just read you some of this. Bipolar depression, as many as 30% of depressed patients are unresponsive to standard treatments for weight loss. For what? First of all, they were saying that people with bipolar depression, the most inheritable of the psychiatric disorders, bipolar depression. So, and it has a heritability is estimated at 85%. So if mom or dad has bipolar depression, 85% chance that you get some flavor of it. So one thing to know is that bipolar isn't just like either you have it or you don't. There's flavors. So there's bipolar type 1, type 2, and then there's these bipolar light, which is like cyclothymia, what they call it. So you can go into low swings, but it's not so much that you're going to do anything about it. But one statistic regarding bipolar disorder that really shocked me was that up to 20% of people with bipolar type 1 may end their lives. 1 in 5 may end their own life. And a substantial number of them, I think it was like 40%, will make an attempt. Let me see. It says suicide death rates among patients estimated to be 20 to 30 times higher than the corresponding rate in the general population. 20 to 30 times higher risk of suicide with bipolar disorder. And all of this may be ameliorated or reduce the risk just simply by how they eat, believe it or not. So depression is a big problem for a lot of people, though. And you don't have to have bipolar depression in order to have a problem. What they're finding in these studies is that if they take a needle and they insert it into the lower back of these patients with depression, they push the needle into the spinal column there. There's no spinal cord down low in the lower back, and that spinal fluid, though, can be down there. It will drip out through that needle into a tube, and then they're going to take the spinal fluid, which looks like water. It doesn't look like blood or anything special. It just looks like water. And they'll take it and analyze it, looking for specific things. In particular, they're looking for inflammatory molecules. Some of those inflammatory molecules are things like interleukin 6 or tumor necrosis factor alpha. Think of those as like the ashes that you see after a fire. Okay. When you see ashes, there's been a fire. And that's what they're looking for. And what they found is that with people with depression and with bipolar disorder had elevated amounts of these things, interleukin 6, tumor necrosis factor alpha. And so it suggests that inflammation is a part of these diseases. And that if you can reduce the inflammation, the theory at the time was that you might be able to ameliorate some of the symptoms, make the depression less, make the mood swings less with bipolar disorder. And in fact, that seems to be the case. It's not a complete remedy, but it does help a lot for some people. And of course, you combine this with the psychotherapy, and for some, there's going to be a need for medication ultimately, because in part for a lot of these folks is that they have an inherent abnormality with their balance of neurotransmitters. And that part, well, as of yet, they don't have something that just permanently fixes that, but the medications seem to help balance that out. But if you can also reduce the inflammation in their brains, you really enhance the effect of these medicines. I found out recently that there are certain supplements that actually enhance the effect of antidepressant medications. I read about this recently. One of those supplements is creatine. believe it or not. And I've got some right here. I take this every day. Creatine is the most, and I don't have a financial relationship with this brand or anything. This is Equate. And I think just about any, version of creatine will do. You don't have to buy those expensive. They have like a special versions of creatine that seem to be more expensive, but I don't think you have to have that for you to get it doesn't seem to add anything is what I'm saying. But as long as your kidneys are good, you need to make sure you got good kidneys because you got to be careful with creatine if you don't. But if you're otherwise basically healthy, with 3 to 5 grams of creatine daily is well tolerated. And then you can get brain benefits at 10 grams. And if you're doing a little bit of modest exercise a few times a week, 10 grams is pretty easily tolerated. Just kind of keep your eye on things if you go up to that 10-gram dose, but it's not particularly dangerous for most people. But it can apparently enhance the effect of antidepressants and make them work better for you. So creatine, again, is the most studied supplement of all time. It has a lot of benefits, even for your bone, for your muscle recovery, and just in general, I think it's a good thing I take about 5 grams of creatine every single day. And I mix it into this other supplement, which is a yerba mate supplement, the best on the market. I'll tell you about that in a minute. But if you're trying to improve depression symptoms, it's now a pretty well-established link between depression and how you eat. One good move is to start to move away from the carbohydrates. And you may even want to go into a orthodox ketogenic diet. That means for most people, it means taking your carbohydrate intake down to 20 grams of carbs per day or less. Okay. And, a lot of people have mentioned that being on the carnivore diet has helped a lot with depression and some other things. I still look at the carnivore diet with a little bit of reservation, but I think, there's no one diet that's for everybody. So keep that in mind. For example, I knew one woman who went on the carnivore diet and she started losing hair pretty bad. Even though she was doing all the supplementation that you're supposed to do, the bone broth and whatever, because if you're going strict carnivore, you do need to do some supplementing because there's some things you're not going to get in your diet. But she did all that and she started losing her hair at 45, not something you want to do. So I'm not saying that everybody that does carnivore is going to lose their hair, but that's what happened for her. So like I say, not one diet is for everybody. She got it back, by the way. So it wasn't like a permanent thing. But on the flip side of that, the carnivore diet is definitely a ketogenic diet, and it seems to have some pretty strong metabolic benefits to it. So I don't poo-poo that diet. I just say, everything's got an upside and a downside. If you want to put your insulin resistance, though, in a 180, so that's really where inflammation in the brain that leads to depression and worsens bipolar depression comes from. It's that insulin resistance starts generating inflammation. Let me show you how this works. I'm going to see if I can't show you this. I put together a presentation on this, and here we go. Bam. And then I'm going to add this, add a source, if I can, share the screen, there we go, and where is it? Bam, here we go, share. All right, there you go. Let me see if I can't expand this a little bit. See what it looks like. Yeah, that's better. So how does eating flour and refined carbohydrates, white rice, a lot of flour, a lot of cornmeal, like cornmeal is basically the main part of Cheetos. Okay. Cheetos is fried corn. It's a pretty unhealthy thing to eat. And then there's like Doritos, which is, cornmeal chips. So what's the best way to what does this do? How does this lead to insulin resistance and then inflammation in your brain? Well, think of it like this. I'm going to go to this. What is metabolism first? That's you taking in food, digesting it, and then releasing energy from that food, and then ultimately turning it into brain fuel and fuel for the rest of your body. But that's the whole gamut of the process right there. But the problem is that if you're eating a lot of sugar, if you're eating a lot of cornmeal-based food, Doritos and Cheetos, and even a lot of cereals are made from this, then you're spiking that insulin level. When insulin goes up really high out of its normal zone, and it does this frequently, you have receptors. Think of insulin as like a little key on a door, unlocks the door, opens it so that sugar can go inside, brings your blood sugar levels down. Ultimately, you then turn that sugar into a form that your brain and your body can use. You have to, it's like your cells are like a refinery, turning it into a form. It would be like when you pull oil out of the ground, you have to refine it into a form that your car can use. You can't just pull it out of the ground and put it in your car. And same thing with your body, the mitochondria of the cell, it basically turns that glucose into a form ATP, they call it adenosine triphosphate, and that's the form that your brain and your muscles can use. But if you are eating a lot of sugar, carbs over time, the insulin receptors get downregulated. There's just not as many of them on your cells. And then secondly, they become like rusty locks. Okay. I told you insulin's like a key, and the insulin receptor is like a lock, and the lock can get rusty, janky. It just doesn't, turn as well. So your body's mechanism for overcoming this is put out more insulin all the time. And so you start to see your fasting insulin. That's, normally insulin only rises when you're eating, but now you start to see insulin is elevated even when you're not eating. That's when the trouble starts. Okay. High insulin levels starts causing big problems. When you've packed in all of that carbohydrate into your mitochondria, then the mitochondria it would be like taking an oil refinery and just dumping oil in it over and over till you filled up all the vats. Now the oil is spilling over the vats. It's gumming up the machinery in there. The machinery starts backing up. It starts malfunctioning. You're not making energy for your brain. And by the way, this machinery is like spinning on the oil, so it's creating sparks and smoke and fire. And that's kind of the analogy, because what happens is your brain and your body's tissues start creating something called oxides. These are reactive oxygen species. They start causing reactions that cause damage to your nerves, damage to your arteries, damage to your cells. And then you start having a problem. So this is going on inside your brain. And that damage that causes inflammation to happen. Now, your brain is a very specialized area. It has its own security system, separate from the rest of your body. It's a privileged space. Not everything can get in there where your brain is. There's something called the blood-brain barrier. In fact, when they're trying to make drugs that are effective for your brain, they have to figure out how to get those drugs across the blood-brain barrier. There's ways to sneak them through, but by and large, from the day that you're being formed in the womb, the compartment that surrounds your central nervous system is separate from the rest of your body. And interestingly, the converse of that is the part of your body that gets exposed to everything is your gastrointestinal tract. I mean, all the food that you eat. In anatomically, we consider the gastrointestinal tract as outside your body. The lumen from your mouth all the way to the anus is considered outside the body when we learn about this in medical school. And technically it is. I mean, it's a tube that goes right through you. That's, not connected. Now, of course, there's things in that tract that you need to help you along. And even though the tract's traveling through your body, it's what's inside that tract is technically outside. And because of that, you have most of your body's defense mechanisms resting just on the inside of you around the intestinal tract. About 80% of your immune system lies around the intestinal tract. If you're eating a lot of sugar and carbs, this same kind of situation here with machinery getting backed up, inflammation happening, sparks flying, that happens around your intestines as well. You start getting the leaky gut that ramps up the inflammation, and those inflammatory molecules can even circulate, to the brain through the blood-brain barrier, causing inflammation in your brain. What's interesting is when your brain cells become insulin resistant, then your brain is starving for energy, even though you're piling on tons of calories in the form of whatever you're eating. You eat that blueberry muffin in the morning. There's nothing, if you want to knock off a couple of IQ points for a few hours, just eat a blueberry muffin for breakfast. There's actually studies looking at eating muffins, sugar-laden muffins for breakfast, and what it does to your cognition. It's a bad choice for breakfast. Okay. Don't give it to your kids either. Don't let them eat muffins for breakfast and send them off to school. That you're just dumbing them down. Give them a high protein breakfast, eggs, steak, whatever, sausage. And that is going to give them, that's brain food. Okay. So as a result of this, the machinery inside the neurons in your brain that are supposed to be making your brain energy start malfunctioning, start kicking off superoxides that generates a lot of inflammation in your brain. It can make depression and bipolar depression a lot worse. So you can begin to get ahead of the depression, which can be a crippling thing for a lot of people. And again, at this point, there are certainly people that are fat and happy, but we are establishing more often than not that there is basically a trend toward depression once people become overweight. And it's not just because you don't like what you see in the mirror. It's because on a physiologic level, how it's affecting your brain, it causes you to become depressed. Serotonin, the happiness neurotransmitter, 80% of it is made by the bacteria in your intestines. But you have to feed those bacteria the right stuff or they don't make enough serotonin. And so if you're feeding yourself a lot of sugar, you won't make an adequate, you'll dumb down the amount of serotonin that you make. And again, that's part of the mechanism where it may lead to more depression. And you just don't feel like doing things when your brain is inflamed like this as well. So it's sort of a never-ending cycle. You feel like you're lazy, you can't do anything to change your life, but that's because your brain is, being pretty well shut down by poor metabolism. If you can adopt, number one, intermittent fasting, which will help to upregulate your insulin receptors again, so that you can begin to properly control the blood sugar, and then it will also make those rusty insulin receptors smooth and oiled again so that the system's working better. And then you're depriving your body of carbohydrate for a period of time like that in the morning, and of food in general. That lets those sparks, those superoxide sparks, stop flying. It gives your brain a chance to, sort of calm down. And then you'll start to see that, your brain fog goes away. You start to see that you have more energy. If you've got an inflamed brain, you will be tired. You won't feel like doing things. So if you were thinking this New Year's, I'm going to turn this franchise around, man. I'm going to get my life together. And then you realize when you start trying to get into that gym on the day-to-day basis, you still feel tired. You just don't feel like doing it. And if you don't correct how you eat along with adopting the exercise habit, you won't get it together. But if you're trapped in an insulin resistant state, well, that causes your brain to crave the stuff that made you insulin resistant in the first place. It's a trap. It's hard to get out of. So one thing that you can do, and this is where I have fallen into something. It fell literally in my lap. Someone came to me, reached out to me, and introduced something to me. I'm drinking part of it right now. This product right here that's sitting in my hand, it does a few things that are key to interrupting that insulin resistance trap so that you can get out of it long enough to give your brain a chance to settle down, to remove some of that inflammation, remove the brain fog, pick up your energy levels, and then change how you eat so that you can then continue the process of improving your metabolism and ultimately lifting the depression that may be connected to that. And what's in here, this is a yerba mate extract. It's comes from South America. Yerba mate is popular down in South America, but this is definitely the best yerba mate extract supplement on the market. It's the highest grade. This is filtered 4 times and is made by a company that's over 100 years old. It's listed in the physician's desk reference. This is the PDR is our Bible of pharmacology. It's Bible of pharmaceuticals. When we need to know about a drug as physicians, we go to the PDR, we look it up there. This is listed there. You don't get in that book unless you've got a lot of credible research. So what will happen when you sip on this in the morning while you're fasting, giving your cells a break from food, insulin, this will raise your GLP-1 by 60%. Now, there are a lot of Me Too copy things out there right now. And I see a lot of so-called nutritional and dietetics gurus and professionals, quote unquote, who are saying that all these little natural Me Too's are gimmicks and that they don't work. No, well, this has been studied at the University of Utah, at Columbia University, at Ivy League Medical Research Institution. It's been studied. It's been now a growing number of major institutions are looking at this particular product. Okay. And what I'm telling you is this is definitely should be your first line treatment for getting ahead of your morning hunger, calming that brain inflammation down, and breaking out of the insulin resistance cycle. Right now, the status quo in conventional medicine is your doctor's going to offer you 2 things. One is metformin, which is a drug that's been around a long time, but it's, has side effects that are uncomfortable. I'm not going to say they're lethal, but if you're a type 2 diabetic, it can land you in the ER. It's rare, but it happens. But if you're not a type 2 diabetic, the chances of that are very small. So it's not a perfect drug. Well, some significant side effects. The second thing they're going to offer you is a GLP-1. Everybody is so high on these GLP-1s right now. But I want to let you think about something. There's this concept in the body and science right now. It's called homeostasis. This is the basics of biology. Anybody that's in college right now, I'm going to be a biology major. In Biology 101, you're going to learn about homeostasis. There has to be a balancing act in your body. And if you push one system one way, there's going to be a pushback the other way to maintain stability of the system as a whole. So when you take a GLP-1 drug like Ozempic or tirzepatide, which was modeled after a lizard peptide, by the way, and a lizard that doesn't eat but 2 or 3 times a year. That's where this idea came from. The guy was like, hey, look, this lizard only eats 2 or 3 times a year. What is it in the lizard that keeps it satisfied all this time? We should give ourselves that and control our hunger. So then ultimately we developed these GLP-1 drugs based off of this concept. Now the peptide you're injecting is not exactly a lizard peptide, but it's where the idea came from, and it's sort of modeled after that. Here's the thing. Your body's own GLP-1. You make GLP-1. Your guts make it, and it has effects on your brain and on your intestines. And it works for about 4 minutes. That's the half-life of GLP-1, 4 minutes. But when you inject that stuff that's an imitation GLP-1, Ozempic, tirzepatide, it works for 10,500 minutes, 2,500 times longer than your body's own GLP-1. So again, let's go back to homeostasis. If you take one system and you shove it to the left 2,500 times more so than it should be shoved, there's going to be a pushback. And what if you suddenly take that away? Well, this compensatory mechanism is going to be like a tidal wave pushing back the other direction. And that's exactly what we see. Not to mention, when you suppress someone's appetite that aggressively, you start to see some serious problems happen. I met a woman 2 weeks ago who has a foot drop on both feet. Okay. She cannot raise her foot like this. Right? Her feet slap the ground when she walks. She trips over things. She's now having to wear braces on both ankles to keep her ankle at a right angle so that her toes don't drop down and she trips over stuff. Both sides. Do you know how many times I've seen bilateral foot drop occur from people losing weight naturally from their own GLP-1? Never, not one time. And whenever I mention this, I hear all these people who've been on GLP-1s and are so happy that they are finally losing weight. And that's great. I'm happy for you. Sorry about that. I'm happy for you. I know that maybe you've been frustrated for a long time, but I am not going to celebrate that with you and tell you you're doing a good thing for yourself. GLP-1s are for diet. Excuse me, this phone is just going crazy. GLP-1s are for diabetics, period. They are not for people this is my opinion, but they are not for people looking to lose 20 pounds or 40 pounds. They are for diabetic patients. And that's it, in my opinion. That's the way it should be. And they're claiming all these benefits all around for drug addiction and all this, but then you also have people going, suicidal on them as well. So if there was another option, the way we're supposed to go about things as doctors, what they teach us is risk versus benefit, right? So we start off with the lowest risk, lowest cost options, and we work our way up the ladder as needed. Higher risk, higher cost, if all else fails. Okay, well, I think GLP-1s should be the last thing we consider using to treat a diabetic patient, or maybe someone who's got, multiple comorbidities with metabolic syndrome. They got advanced heart disease and all this other stuff and everything but florid type 2 diabetes, and something bad's going to happen to them if they don't get it together in the next year. Okay, fine. Go on a GLP-1 then. But if you're moderately healthy, you're mid 40s and you're not teetering on the edge of a heart attack, and you don't have type 2 diabetes, you should not be taking these drugs, in my opinion. Full disclaimer, this presentation is educational purposes only. Do not make changes in your medication without your doctor's advice. Satisfy the lawyers there, but that's the fact. That's the way I see it. What we're seeing is about 40% of the weight that people are losing on these drugs is in the form of muscle and bone. It is muscle that is what makes you metabolically flexible so that you don't go into this insulin resistant state. And if you lose it, particularly in your older age, after 35, 40, that's what I mean by older, then you become metabolically less flexible. It's easier for you to flip into insulin resistance and get all of the problems that go along with insulin resistance: heart disease, kidney disease, high blood pressure, dementia, cancer. Your cancer risk goes up if you're insulin resistant. Infertility, hair loss, skin diseases. I mean, the list goes on. Everything is connected to insulin resistance. It makes everything worse. MS. If you've got MS, just become insulin resistant and you can speed that timeline up, how fast things get worse for you. On the flip side of this, if you just simply leverage your own body's GLP-1 at the right times for the right amounts, just a little bit of a shove, not a 2,500 times shove, but just a little bit. You don't lose muscle. You don't go blind. You don't get gastroparesis and paralyze your intestines. You don't give yourself a bilateral foot drop. You don't get thyroid cancer or any of that other crap. Okay, why do you want to take on all this baggage? This should be first line treatment for anyone with metabolic syndrome. It should be mandated. People are figuring out about this, though. This has gone worldwide. There are more and more physicians now that are figuring out about this, and this is beginning to take over as the first line option. How do you get it? If you're interested, this is called the Feel Great system. It's two parts. So the yerba mate tea is the first part. All you do is you put it in this bottle, you mix it up, drink it. It's easy, 15 seconds, and you're on your way. And then you drink 2 of these a day, along with, I've got another one. See, I'm traveling today. I'm doing an emergency room coverage for neurosurgery here in Mississippi. And the second part of the system, is Balance. Balance is a collection of about 10 to 14 different plant sources of high-grade soluble fiber. It's also got the phytonutrients. When I talk to you about inflammation in the brain and elsewhere, the phytonutrients help mop up inflammation. So the fiber in this, you can't digest it, but the bacteria in your guts can, and they turn this into short chain fatty acids, things like butyrate and acetate. And those things have a very anti-inflammatory effect. They act at a brain level to help make you less hungry. They help with cholesterol, they help with glucose level control, and basically help you to reverse insulin resistance. So it's a 1-2 punch on insulin resistance. Use this, leverage this tea, which has a direct effect on your cells, making you less insulin resistant. And it helps to suppress your appetite because it raises your body's GLP-1. When you're not eating, you're already reversing your insulin resistance. And then you're putting this in front of your meals at mealtime, 1 pack before your largest carb-containing meal of the day. So you fill it in the same bottle, fill the water to the lower line, dump this in, shake it up, drink it, just down it right before your biggest meal of the day. They got multiple flavors that taste great. They just came out with a new berry flavor, wild berry flavor. It's delicious. And there's nothing in here that you wouldn't feel upset about putting in your body. Okay. Sweetened with stevia. But within 48 hours of starting this, you will notice something is going on. You're ahead of your hunger. You have control again. You start to feel better. The brain fog goes away. The energy levels come up. And then after a few months of this, you might start, your clothes are looser and you need to go get some new ones, which don't fit anymore. That's exactly what happened to me. My mental stamina started going up. My cognitive flexibility at work, as a neurosurgeon, you're doing a lot of think work. And I just noticed my mental flexibility started getting back like it was, when I was 18 again, and I could just, the brain was just working, and I was getting leaner and feeling better. This is how you interrupt the process for insulin resistance. It's an assist. You need a little assist to break out of that. And this absolutely will help you get started. Now, from there, of course, you have to eat properly. If you don't do that, see, that's what's happening with Ozempic. I know a person, I will not name them. Here's their strategy for weight loss. They get an injection with Ozempic. They don't eat all day, and they have a bowl of Fruit Loops at night. That's not how, even if you're going to use Ozempic, that's not how you're supposed to, but that's how people are using it. They take the Ozempic or they take the tirzepatide, and then they eat whatever the hell they want to at night and think they're doing themselves a favor. You're not. Okay. You're eventually going to have to get righteous with your eating, or you will never get better. Okay. But this is a natural assist. And then, as another huge assist is who you hang out with. And when you subscribe to this, let me show you the link to it, by the way, so that you can get it. Here it is. All you got to do, if you're a boomer like me and you don't know how to use this little thing, screenshot your screen on your phone right now. Hold your thumb down over that QR code, and it will take you to the website. Okay. And that's how this works. So screenshot, hold your thumb on the QR code. It'll take you to the website so that you can get this. And you're going to get a permanent 32% discount on the product through this link. You get a share link of your own when you subscribe to it that you can share with others, and you'll get a $10 credit for each person every single month that they stay subscribed. So you can actually probably almost get this for free if you get enough people to subscribe through your link. And then you can also, you get a 90-day money back guarantee. So you can trial this for the first 3 months for the next 3 months and get your money back if you're not satisfied with it. but most people are satisfied with it. I haven't had yet in 3 years anyone wanting their money back. They're all satisfied. The ones that take it properly, you're going to get, I can see the same result over and over and over again. I wish I could show you some of those results right now, but I'm on a laptop and I don't want to risk losing my stuff that I've got here so far. So again, if you know someone who's in this situation, maybe they're experiencing depression, maybe they got bipolar disorder, someone who's not metabolically healthy, they're pre-diabetic, they're diabetic, they're carrying extra weight, they're hypertensive, they've got heart disease, show them this system, introduce this to them, share this with them, and let them trial it for 3 months. See what happens. Start using the Feel Great system, turning the metabolism around, come this with a better way of eating, cutting back the carbohydrates. What carbohydrates you do eat are complex carbs, things like sweet potatoes and quinoa and black or red rice, beans. Those become your carbs at that point. Focus on the meats, healthy fats, and you'll start to see your franchise turn around. And you'll feel better, almost within days. It only takes 6 weeks of bad eating to put yourself into insulin resistance. Just 6 weeks. How many of you do you think have been in insulin resistance for decades? If it only takes 6 weeks to get you there, and you've been eating not right for a long time, how many years has it been? All that time, you're taking a bigger hit. There's this concept in medicine, it's called end organ damage. Ultimately, your organs, they're taking a little hit every day, and eventually they're going to fail. But you are pouring jet fuel on the process if you're insulin resistant. Okay. You want to slow that process down as much as possible so that you can, not just so you can live longer, but you can live better. It's not about just putting more years in life. It's about putting more life in your years. And this has definitely done that for me. I hope you found this useful. Again, screenshot your screen, hold your thumb down over that QR code, subscribe to this for 3 months, do the 3-month experiment and see what happens for you. I will be in touch with you. And speaking of who you hang out with affects how your metabolism is. I will start contacting you once a week. We'll help you get the best and highest use of the product. Make sure we troubleshoot anything that you need, have any obstacles with. And I'm connected to a bunch of dietitians and nutritionists in this as well. So anything I personally can't answer, I've got people. And we will get your answers. You guys have a great